Ascension Health is running a number of pilots around the country to determine the best way to address the population health issue. And the one at St. Thomas is called Mission Point Health Partners. It's a partnership with about 1,600 of our physicians and all of our hospitals and ambulatory surgery centers and so forth, that creates a platform that's payer agnostic to care for populations. Well, there are a number of differences. First of all, after an HRA is done, when someone becomes a member, they go to an online marketplace and select a personal physician for their medical home. We don't have the traditional medical home model that meets all the criteria for accreditation because our providers can't all really do that today. So we supplement the medical home with health partners, and I can talk about health partners in a minute, but I think you were probably going for the compensation mechanism. And it is partial capitation. We do provide the patient-centered medical home providers with a primary care management fee, which varies based upon quality measures, but also varies, and we've found that our customers, which are predominantly self-funded employers, are really interested in service measures. So we look for, we provide an extra monthly payment for people who do after hours visits or Saturday office hours, or who will relate with patients via email. So there are a number of service criteria that'll bring that fee up. Everybody else is on fee for service. The first year, self-funded employees, members, experienced a 50% drop in their emergency room utilization because the health partners are taking those calls and advising them. Significant drop in hospital readmissions and hospital utilization, a higher degree of patient satisfaction, and the savings over the anticipated spend were 12%. Population health is really good for someone with chronic disease. And the patient with chronic disease can't be allowed to fall through the cracks at a transition. And even the government figured out that congestive heart failure patients were coming back in the hospital at too high of a rate. So with the health partner model, the health partner is going to see that patient in the hospital before he or she goes home. Let's say the congestive heart failure patient. Make sure that the instructions are understood. Call the patient the next day. Be sure that the post-op follow-up visits are done. And if necessary, check on the patient's weight or the patient's medication compliance as needed. Again, always working in tandem with the primary care physician. Well, I think the population health model is the only hope for U.S. healthcare. I think the alternative is single payer and rationing. So I hope it catches on quickly. I know there are those who aren't convinced. It's also difficult to navigate as we move from volume to value. It's hard to have one foot in each canoe. So the faster it happens, the better.